All right, thank you for that, Steph. It is a phrase we've been hearing more and more of, social distancing. The weekend on the doorstep, many of us thinking about what to do. Well, Toronto's top doctor says for now, do not get together.
Having your friends over for dinner or for coffee is not social distancing. Arranging play dates for your children is also not social distancing. Visiting friends or family in long-term care homes or hospital is not social distancing.
Now, some tips include avoiding that close contact with others, staying at home only to go out for the essentials, food, medicine. Try to work from home if you can, and think about online grocery shopping or other options here. But many are also wondering how long we're going to have to keep our distance for and how exactly it helps flatten the curve. So more on this, I'm joined now by infectious diseases expert Dr. Isaac Bogosh, joining us via Skype this morning. Good morning to you.
Good morning.
So let's begin here first. Social distancing and how long? There are new report out saying that this could be 6 months that we need to do this for it to be effective. Your thoughts on this?
I mean, the short answer is that we don't really know. And a lot of this is going to depend on how well Canadians really implement these strategies. And I think if we really band together and actually, do as the senior public health leaders are requesting, it might be a bit of a shorter time. Certainly, I think the next 2 months, we can expect this to be the new normal. It might be longer. It really might be. But I think we can confidently say 2 months of this is certain. And then beyond that, it's unclear.
When we look at the idea of flattening the curve, people are throwing around that term. What does it actually mean with the trends and what we are on track for?
So the graphic you put up is absolutely spot on. And in the red part, you can see a rapid increase in the number of cases. And that's exactly what we want to avoid. We do not want that. And if we don't practice social distancing and really mingle with one another, we'll see a lot of transmission in the community. And we see those rapid upswings in case numbers, which is really not a good thing to have, because that can overwhelm our healthcare system, in which case people who are sick enough to go to hospital really won't get the best healthcare that they deserve. The other curve you see there is when we do practice social distancing, restrict travel, and really don't mingle with one another. And you just see a much more blunted curve of numbers of new cases of patients, of people infected with this infection. And basically with that curve, we spread this out for a little bit longer, but we just don't have as many sick people at any given time. It gives the healthcare system tremendous capacity to handle those patients and really provide people with top quality care. And we avoid situations like we've seen in Italy or Iran, where their healthcare system is stretched beyond capacity.
I want to ask you about some personal experience. You were abroad, you were in Singapore as well, traveling other parts of the world, researching and helping in the fight against coronavirus. What did you experience? And it's a very different world from when we last spoke, even just, a month or so ago.
Yeah, I mean, it was remarkable. I mean, Singapore has done a wonderful job in getting their cases under control. I mean, I get it's a city state, but they have really implemented social distancing beautifully, and they've harnessed technology to really facilitate tracking potentially positive individuals, ensuring people who are positive for this infection are in isolation, supporting the families of positive people in isolation. So Singapore is one of the models of how to do this right, and they've by and large weathered the storm much better than others. A lot of these meetings that I was in, though, was really to look at improving safety with air travel. We know that, of course, planes continue to fly, although less and less. And really, these were strategies to see, how can we make this safer? We appreciate that there is going to be some travel. There has to be for emergencies. And how can we work together as, healthcare providers and working with the private industry as well, with the airplane companies, working with the WHO to really set some standards and guidelines to reduce the risk with travel.
Oh, there's so much more to discuss, and I wish we had more time. So hopefully we can check in with you again, because as we know, this is far from over. Thank you, Dr. Bogosh.
Nice to chat.